a network of the nation's food banks, in which they said that 22% of the children in the state of Texas experience hunger on a regular basis. So unfortunately, Texas does have one of the highest percentages of children that go to bed hungry every night.
And this has increasingly gotten worse in the last
Yes, because
4 or 5
of the
years.
economic crisis, many people being out of work. Many people were working a couple of jobs before and were able to probably live, you know, at a certain level with food and pay the rent. But now the choices are much more difficult. Do you pay the rent? Do you get the health care you need that week? Do you buy some clothing and books for the kids to go to school, or do you buy food? So it's a difficult choice.
And actually, Texas is one of the closest states for immigrants from South and Central America. And many of those countries are very poverty-stricken.
Exactly.
And so they leave coming to the states looking for a better day.
Yes, exactly.
And you know, if I lived in somewhere like that, I would probably do the same.
Exactly. They're looking for better lives. At least a few years ago, there was work for them. Now, with the downturn in the economy, the downturn in the housing industry, many immigrants are now returning back to Central America and finding that when they go back, there's nothing for them there, and the situation's difficult. And to complicate this, there is violence and danger in those countries, which is another reason that some of them are leaving and coming to the north in search of work, is because of drug trafficking and other criminal elements.
Now, have you done enough study to see whether or not non-citizens have any access to food?
Well, in the current situation, legal immigrants have been able to access food through our federal programs in the past. But illegal immigrants usually are not able to access these programs. However, they are not turned away if they go to a food pantry or a private shelter or a private organization. So there is a lot of concern that undocumented workers or even legal workers are going to be discriminated against to access food. So there's the domestic anti-hunger constituency is really trying hard to make sure that this doesn't happen, because it doesn't help to have particularly children that are malnourished in the long run.
Well, many times we know that many are not going to leave, and they're going to be ultimately become citizens, and the kids are going to be educated in our country, and they're very likely to remain. And when nutrition is so limited as they're young, as they grow older, they usually carry with them some malnutrition disease or ailments.
It's very important to get that early childhood nutrition, particularly during the time when they're in the womb and then up to 3 years of age. And there are a number of wonderful programs that are developed even by developing countries. I want to just mention a couple of them. Brazil, the country of Brazil, has really taken a lead under the President Lula, who came in on a platform of ending hunger in his country. And they have set targets and goals, and since he arrived in the country as president, since he was elected president, they've made incredible gains on cutting hunger in Brazil. And they are actually using their model of school meal programs, supplementary programs to mothers and infants. Their whole package is now being looked at by other developing countries as a good model. They share their expertise and how they set up their programs with other countries in the developing world. So it's kind of a South-South cooperation. Mexico has also set up a very solid program of food security and nutrition, particularly for children. And Chile, those three countries, Chile, Brazil, and Mexico, have all established or are in the process of establishing very good what we would call a safety net program for children to get better nutrition. And that really bears out in the long run to be one of the best investments you can make as a country.
You know, Brazil also has become energy independent. And so the management of that country seems to me is a little ahead of some of the rest of our countries.
They're very forward-looking, and in fact, you know, Brazil has actually met their commitment to cut hunger in their country by half, ahead of schedule. Many of the countries around the world made a commitment in the Millennium Development Goals to cut hunger and poverty in half by 2015. And Brazil's one of the few countries that has actually met the goal so far. They've already cut hunger and poverty in half since 2000. So they've you know, actually exceeded their goals. And they're a wonderful example.
How is it managed?
Well, the program in Brazil is based as a federal model, and they have also state level administration. So there's all kinds of packages that they offer, but they target the poorest households. They actually have what's called a conditional cash transfer program, and that means that each household receives a small amount of money every month deposited into a bank account. And that is given to them conditionally based on taking their child for regular health checkups, keeping their children in school, providing them with nutrition and vaccinations. And it's a very integrated package, and it's also integrated with the private sector in Brazil. So everybody plays a role. The private sector plays a role, community groups play a role, and the federal and state governments of Brazil play a role.
Do you have any idea what the population of Brazil is?
I am actually not sure about that. I was in Brazil just a year ago, but I don't have the overall population.
It probably is not much more than the population in Texas. And I'm just wondering if we could use that model and take a look at our problems.
Well, it's a very interesting idea. It's a very interesting idea. They have, I believe they actually probably have more people than in Texas. They actually have a very, very solid school feeding program in Brazil. I believe that they're actually feeding more children in schools every day than we are in the whole U.S. So the Brazilian school feeding model is also a very excellent program.
Well, when I was in the Texas House many years ago, when Mickey was there as well, I passed a bill to make the breakfast mandatory as long as the federal government had it. And it was so difficult to do because so many people just did not want to have it. Texans are a little skeptical of federal dollars for fear that they think that the people get accustomed to them, and when they no longer come in, it becomes a responsibility of the state. But that's still going on, and the reports on it show very clearly that children attend the school much more. They are much more alert in classes. They look forward to coming to school if they're going to get a breakfast.
And it's much easier to learn when you're not hungry, and when you're feeling weak, and when you don't have an attention span. So it's the school breakfast program and the school lunch program are just really critical programs to have in place, whether you're from Texas or whether you're from Virginia or Oregon. Any of these places have children who oftentimes don't get to eat at home, and so it's good to just remove the barriers, let them have a nutritious meal at the start of the day, and they will learn much better. They also come to school. Overseas, what we know is that if you provide a meal or a snack in the school, you actually attract the girls into the schools. And hunger overseas is very much a gender-related problem. If you have a lot of absenteeism from school, usually it's the girls who are missing from the elementary schools overseas. And why is that? Because their labor is oftentimes needed at home to do things like collect water or fuel or help with agriculture. And so if you provide a small incentive like a school breakfast or a snack in the developing world, you get girls into the schools. And what does that do? That will also delay the rate of those girls having their own families, which means that it slows down the population growth in many countries. It helps girls become more educated, and they become better mothers because they're having children at a later age, and the whole population benefits. So it's a big investment, and it's an important investment.
Yes. Now, we also